So I am Dr. Neeraj Tyagi, and 6 June 2023 I will talk of scientific basis of yoga in therapeutics. See, yoga affects the mind and it connects us to God, the infinite power. Now we'll see about what is happening in our body. HPA axis, we call it hypothalamo pituitary axis. Hypothalamus releases gonadotropin releasing hormone and CRH like hormones which direct the pituitary gland to release ACTH, adrenal corticotrophic hormones, and thyroid stimulating hormone, and follicle stimulating hormone, and luteinizing hormone. So, which again affects the adrenal gland to release cortisol, which is responsible for diabetes, TSH responsible for hypothyroidism and hypothyroidism, FSH responsible for polycystic ovarian disease, and that leads to infertility. So, the disturbance in this HPA axis virtually leads to endocrine disorders. If any of these axis is getting affected, it leads to the particular disorder. Now, how yoga treats it? Because yoga is affecting the mind, it leads to relaxation of mind, which means this starts acting better because stress levels are reduced, the brain starts functioning more properly, the mind starts on being relaxed, this axis becomes better and more synchronized, and it leads to amelioration of diabetes, amelioration of hypothyroidism, and polycystic ovarian disease, infertility is cured. Because stress is the main thing responsible that destabilizes this axis. So yoga leads to relaxation of mind, and relaxation of mind means there are more neurochemicals and neurotransmitters in brain to calm it down, to make the coordination between neurons better, and to help mind act more effectively. So all these functions become better. So on doing yoga, you are resting your mind, relaxing your mind, and it also connects you to the God, the infinite power of healing. Now we come whether medicine is more effective or yoga is more effective. See, power of medicine is much more less than of yoga, because yoga connects you to God, the infinite power of healing. Medicine has its limited power. Say example, you start in a BP of 160 by 110 millimeters mercury with 5 milligram NVAS, the medicine for BP. As the stress will increase, if it has resulted in 120 by 80 normalizing of BP with the stress, this will again come to 160 by 110. So then you start with 10 milligram NVAS, and if stress is again increased, the conditions of patient doesn't improve, it will again feel, and then you will have to add say 10 milligram NVAS plus 5 milligram amlodipine. So what happens is, as the stress is increasing, the dose of medicine is failing. So power of stress or mind, because stress origin is in the mind, so if you relax the mind, you will not need to increase the medicine, maybe the need for medicine goes forever. So because stress is dealing with the mind and mind is the seat of stress, you have to control the mind with yoga, and the stress levels will go down and all this will fall back to normal. Even the dose of medicines will be reduced, or you will leave the medicine forever. Thank you. So yoga is better than medicine. Thank you.